All right, so welcome to the HL7 FHIR Connectathon May 2024. We are going to run a dry run on the PACIO, Advance Directive Interoperability, and we have a lot of great participants and people here with us today. So we want to thank all of you for your time and your effort. Just a quick reminder, when we're talking about advanced directive information, it is not prescriptive as to a jurisdictional form. It is intended to be overarching and to represent all the different types of documents that can memorialize someone's advanced stated goals, preferences, and priorities for care, should they be unable to communicate those at the time at which service is rendered by a medical provider. Under type 1, we have person authored information. Those might be those jurisdictional or state advance directives, living wills, durable medical power of attorney. They might be personal advance care plans, the type of things that you would find at My Directives, 5 Wishes, Prepare for Your Care. There's a number of them. And again, they are for a potential future event. They are used when the individual cannot communicate or make decisions for themselves. There is no contract, there is no requirement, and they may identify someone who can advise the medical team on the individual's behalf. Type 3 are portable medical orders. Those are created by practitioners, and those practitioners will create and sign those orders just like any other doctor's order. For all practical purposes, this is an order set. They are done in combination with the individual. They are not autonomously done by the practitioner, and they are intended to follow the patient across care settings, unlike normal doctor's orders, and be available across the continuum of care. They are informed by the patient or their designated healthcare agent, and they are basically orders for treatment provisions that the individual is given to their doctor. Yes, I want CPR, or no, I don't. Yes, I want every ounce of medical care that is available to the team, or no, I only want comfort care, or something in between where I do want medical care, but I have some very specific things I need to share with you that may be personal, cultural, religious, or spiritual. Those are the 2 types of advance directive information we will be covering in this Connectathon. The track participants, and we're grateful to all of you. We have had a number of organizations come together. We're going to see a reference implementation EHR, a live EHR. The state of Washington has come with their consumer-facing app. We've got My Directives app. We've got a host of people who have worked long and hard to make what you're about to see possible. And we're grateful to MITRE for providing the technical framework and guidance that they are oh so good at. An overarching view of the scenarios can be found on this particular slide, and we will make this available. What we're going to do during this Connectathon track, however, is to deconstruct this, because that's what we do in this particular HL7 organization. We're going to deconstruct it, and we're going to take it bit by bit by bit. But this is an overarching vision. On the very, very left, under the patient persona, you can see who Betsy Smith Johnson is. Who are the people that are important to her? What's her past medical history? What are the medications that she is taking at home? And then, of course, we love our 3-letter acronyms, our TLAs. So we've got an acronym table here for all of the observers. We're going to set the background, what happened before we launched into this, and we will again take each of these and deconstruct them into separate scenes. Then we're going to move Betsy through some changes, some things that she does, and how the technology will move the information and make it available. In scene 2, we're going to add more types of documents. Again, this is a very broad-based project, so we want to make sure that we're demonstrating a number of different types of assets and advanced healthcare directive document types. We're going to make sure that that information is available to be accessed by a health information exchange or by a provider that may want to access it. So we're going to make sure that the share use case is well demonstrated. Something that we have run into is that an individual has every right in the world to memorialize how they feel about advanced medical care, and then at some point say, well, I either want to update that document because I have new life experience, or I'm going to revoke this document. You know, I thought this was a good idea. I don't like this particular instrument anymore. I'm going to go to a different instrument. So I'm going to revoke this last version that's out there. It is well provided within the National Post guidance that an individual can revoke their Post document. And so that revocation use case is extremely important for us to delve into in this Connectathon. And then lastly, we're going to talk about portable medical orders and how all of that occurs. So that's just a very high level overview to give everybody a taste for the fun that we're about to have today. Now, of course, there are technical roles that need to be fulfilled. There are systems that enable the creation of digital assets, in this case, the Advance Directive information. There are systems that contain those assets, those documents, and make them available to external parties. Maybe it's my new doctor who wants to know everything they can about me before they start to treat me. Maybe it's an emergency room. Maybe it's an emergency response individual. There are lots of scenarios for who the receiver can be. And that is, in technical speak, starting again on the left, if I'm creating something, I'm the FHIR client. If I'm the registry, I'm the FHIR server. And on the right, there are just a number of other FHIR clients who are receiving. They've issued the query or they've received the push. And so they're receiving those digital assets. Now for some fun. In the background, we have our favorite patient, Miss Betsy Smith Johnson. And she spent multiple summers with her family in Michigan. And not long ago, she said, you know, I can't live in Texas by myself anymore. I'm going to move to Michigan where my family is. I love my summers with them. Really, my health is declining. And I think I would like the increased support that I get from my family unit. So Betsy's son, Charles, urges her, Mom, you're leaving Texas. You're coming up here to Michigan. I'd really like you to memorialize your advanced healthcare decisions so that if you need medical care here in the state of Michigan, it's accessible in your new home state. You know, they might not like those Texas forms, so let's create some Michigan forms. Now, Betsy has a history of bipolar illness, accompanied by some pronounced manic episodes, and she has managed throughout her life to actually deal with these conditions in a healthy way through behavioral psychology. But she knows that some of this is worsening in conjunction with her worsening physical conditions. So she understands that creating advanced care planning documents that are available to her new providers really helps them deliver personalized care. So she grabs a piece of paper, and it's a Michigan Advance Directive. And actually, in the state of Michigan, they've got a fillable PDF, but she can handwrite it, or she can just pull it up on her phone or her tablet, and she can fill it out by hand. And so we have a version of that Michigan Advance Directive shown in the slide on the right. That's the Michigan Advance Directive that she has created. Now, she uses a consumer-facing application to take that paper document that she turned into digital form. She could have taken pictures with her phone. She could have run it through a scanner. There's a number of different ways you can capture paper and make it digital. And she uploads that to a consumer-facing application. She is able to share a copy with Charles. I mean, he's her healthcare agent. If something happens and she can't speak, Charles needs to know what is in writing in her documents. So that's where we are on the background information. I'd like to stop sharing my screen, and our friends from the state of Washington have a consumer-facing application that we would like to show you guys to demonstrate what we're talking about.
Thank you, Maria. Share my screen here and pull up our Washington State Department of Health Law Verify Plus International Patient Summary, which can bring in a bunch of data from different sources, including US CDI Smart Patient Data, and we've added advanced directives here. So I will make a query against the AD Vault for Betsy's document references and patient resource. So query those, and we can see that Betsy is here, and we have her address in Michigan. And we can look at the document reference as well and see the type is combined living will and medical power of attorney, and that it's a Michigan Advance Directive. We can track some details that aren't of interest to the end user here, really, but we've surfaced for technical transparency. So the set ID from the document reference, version number, and the date, and view of the PDF.
Thank you, Justin. That's fabulous. So what you could see off of what he presented is Betsy would be able to use that application. Oh, this is version 1. Yes, it was created in December of 2023. There's just some beautiful salient information that they're able to render through that consumer-facing app. All right. Now, this is scene 1. In scene 1, so Betsy's done all of this stuff historically, right? So she's uploaded this Michigan Advance Directive. Now we're into the nuts and bolts of what we're looking to demonstrate in this Connectathon as well. So in scene 1, she says, well, gosh, I've got this Michigan Advance Directive. It's just pretty short and sweet, and nobody's going to know anything about me. Who am I? What's important to me? So she uses a patient-facing app to create a structured personal advanced care plan. And you can see the LOINC document type code here. And it contains much richer context about Betsy as a human, not just do or don't I want CPR and what are some basic medical decisions, but who am I as a person? And while she's at it, and again, her son Charles is really helping to guide her. She says, I think I'm also going to create a mental health advance directive. I'm just afraid that something's going to happen with my bipolar. And it's very rich when it comes to what it shares on my behavioral health condition. So I'm just going to do that. I'm just going to do that. Now, that's on paper. So that's an unstructured mental health directive, as well as a structured personal advance care plan. She does that through a consumer-facing app. And of course, that application pushes that to a national registry and repository so that it is available. And what I'd like to do is go on over to a consumer-facing app and give you guys an idea of how that looks. So in the consumer-facing app, Betsy has gone through and not only uploaded documents, but she has created version 1 of her personal advance care plan. This is a structured document. And this structured document in this Connectathon, we've since made other versions, but version 1 is clearly visible here. There is structured data that we're going to be able to show you in the registry in just a moment. And that registry will show all of the concepts that are tied to LOINC and all of the structured data that she has answered in response to the question. Now, the original version looked like this when it was printed. There was version 1. It was created on a particular date. It's got all of the information that is out there. So you will see in the application version 2, but you can see that it tracks the metadata on what was done. Just go to my documents real quick. So there's her personal advanced care plan and the mental health directive. There you go. And if you look at the mental health directive, you can see why it is such a unique instrument and why it was so very, very different from the personal advanced care plan. So you can see treatment preferences regarding her behavioral health. Does she want electroconvulsive therapy, ECT? Who do you call? Who do you not call? Mental health directives are similar from a high perspective, but very diverse and important if you move through the behavioral health system. So I thought it would be important to draw that distinction. We're going to show the registry and demonstrate to you guys how the data is moving and being made available for data exchange. And then we'll flip over to Washington State.
Okay, so what we're going to show now, interjecting in here, is a window into what's happening as the data is flowing into the registry. So the screen that I'm showing is just an artifact to allow us to expose what really happens as an automatic transaction. Documents are inserted into the registry, but I just wanted to show you how this happens. So the document, the personal advanced care plan that Maria was talking about, is available to be inserted. The registry takes a digital signature process and seals the document before it's loaded into the registry. So it's exactly preserved as it was provided. And then it is imported. And by importing this into a FHIR registry, the documents, I'll just show you right now what has accumulated in the story that Maria's been orchestrating for us. If I query on Betsy Smith Johnson as a patient, you can see all of the registered documents that have been entered so far and the FHIR resources that are available with them. Here's the Michigan Advance Directive that you saw initially. You could view this document and see it also, rendered here in the registry, but it's an unstructured document with a little bit of header registration information. But you also can expose the FHIR resources so that you guys can get a feel of what's actually going on. Here's the mental health directive document, an unstructured document, and here's that personal advanced care plan that we just loaded. And I'm going to open the document reference resource, which is a resource that's just really unique for a document registry. These are the index cards that keep track of all of the various documents that are available for query. And I'll just quickly show you that the information about, for example, the documents, clinical document ID and the document set ID is maintained here in this resource. Statuses for the resource itself and the ultimate document status, the coding about what kind and category it is, the patient, the authenticator, the custodian, etc. And then you can see that there are available for retrieval multiple different formats of this document that is attached. And anything from a CDA document to a FHIR document as a bundle and as a binary, and even a URL to the actual FHIR composition resource, sort of the live view of the document. So the registry is really acting in each one of these scenes to process this information and then make it available for all of the other recipients who are querying and retrieving the patient's information.
Thank you so much. Justin, could we go ahead and display what the Washington State consumer facing app is able to present?
Back at our application, and we'll do a fresh search here. And have a look at the updated document references. Here we see 3. And let's see, so this is the one we saw earlier, and scrolling down through these, then we have the mental health directive, and see that that is the current status current there in the version number 1, and that there is a PDF available in that one. And then for the next one, the personal advanced care plan, and that is also version 1 and the current.
All right. Juby, did you want to go ahead and show in your application how you can access the instruments that we have presented so far? I was going to bring you in another scene or two, but it's really important that we really show the full evolution.
Rahul, are you able to pull it up?
Yeah, so we have EMR, then our Betsy Smith Johnson patient is in a realistic setting, would be all their information would be here, and so go into them and then open the Advance Directive section that we made, and then it should query the server and pull up the current version 1 of the Advance Directive, and the mental health directive.
That looks spectacular.
Thank you, Rahul.
That is a live EHR. Vanessa, would you like to take over the screen and show via the reference implementation how a different EHR would reflect those documents?
All right. So here we are on Betsy profile. We can see her birthday, November 15th, 1950, and her address in Kensington, Detroit, Michigan. I'm going to query her advance directives now. Yeah, so we can see here her combined living will and medical power of attorney, the first version that was created. Her mental health directive, first version. We can look at the PDF version of it. And last, this is her personal advance care plan, which is a structured data. So let's take a look at that. And we can see all her personal care plan details, the clause, and also her healthcare agent. And that's her personal care plan.
That's phenomenal. Thank you so much. You guys have just done amazing work. So it's just very exciting to see it come together. Okay, so for scene 3, Betsy knows that her health is changing. And, you know, when she created that personal advanced care plan back in December, and you know, it's been a few months and she's like, gosh, you know what? I just really want to make some changes. I mean, I did a Michigan Advance Directive. I did a personal advanced care plan, and then I did a mental health directive. And I really want to make sure everything ticks and ties. So she goes in to her consumer facing app and she changes her personal advanced care plan. When she changes it, it creates version 2. And I think I had already gone in and showed you guys version 2 in the My Directives app. In fact, I had a hard time showing you version 1 because it's going to surface the most current version of her personal advanced care plan. This is structured data. And because she has created this in her consumer facing app, she has the ability to make sure Charles gets the new version, to make sure that the HIE gets the new version. So making sure that that update and that query retrieve to verify the current version, that's a part of our core constraints of the IG. So we want to make sure that we share that with you guys. We're going to take you through the applications, through the participants, and let you see how those changes can be viewed. So we have an newly updated, you remember, the personal advanced care plan was originally dated December. Now she's made changes, and her version 2 is going to show things like, please review my mental health directive. Well, she didn't have one back in December. So she's making sure anybody that accesses the document has the opportunity to go, hey, I created one of these. Make sure you go look at it. Oh, by the way, I created one of these. So you can see some things were changed, some things were not. So you can see the updated version of that personal advanced care plan. Now, the registry has the newer version, and I think it has already made it available, right, to our participants. Excellent. Let's go ahead and have the reference implementation demonstrate the newer version of the personal advanced care plan, and then we'll swing it over to Juby's team, and you guys can show some of the structured data that you represent so beautifully. So Vanessa?
All right, so we are back on Betsy's profile. Let's fetch the directives again. And we are looking for the personal advanced care plan. This is the version 2 that was created. And we can take a look at, so we have here the additional document section, her thoughts on what she likes. And we have here the signing of my directives advance care plan, and also the witness on that. So we can see here her goals, preferences, and priorities, and also the expression of healthcare treatment preferences and her healthcare agent appointment. And yes, that's about it for her new update.
And I love the presentation of the structured data. It's really just a great part. It's like gravy on your biscuit when you've been involved in these Connectathons as long as this team has. Juby, I wonder if your team would do us the favor of demonstrating in your EHR the updated personal advanced care plan. You guys have a beautiful presentation layer on structured data.
Okay, so we have version 2 of the advanced care plan. I guess there's the option to look at the older version. Let's see. So yeah, there's a couple different tabs to look at the various information. And let's see. Okay, so that looks like the newer version, I believe. So yeah, that's what we have here.
It looks fabulous. All right, great. So in theme 4, we see Betsy going to her new oncologist in Michigan, and Dr. Onco uses her clinician-facing app to say, hey, state HIE, give me everything you got on Betsy Smith Johnson. And the existing Advance Directive documents are retrieved directly into Dr. Onco's clinician-facing app. So she reviews them, she takes a look at what her preferences are, talks about risks and benefits, and she says, well, great, I see a personal advanced care plan, lots of information about Betsy. I see a Michigan Advance Directive. I see a mental health advance directive. Betsy, I just want to share with you as a practitioner, this is a lot of stuff. I just wonder if we don't need to revoke one of these documents and simplify what someone in the emergency room would find. Why don't we just remove one of these? And Betsy said, boy, I trust you completely, Dr. Onco. I'm going to do that. Betsy uses her consumer-facing app to revoke the Michigan Advance Directive. And as you would expect, that consumer-facing app communicates that with the registry so that the connected EHRs and the connected consumer-facing apps are also able to show that revocation. What you may notice when you look at the consumer-facing app is that the Michigan Advance Directive is missing, because when it's revoked in the My Directives consumer-facing app, it's no longer visible. Now, is that revocation, is that metadata still out there? Oh, yes, it is. How about the Washington State consumer-facing app? Show us how you render that revocation to a human viewer.
Certainly. Let's go back to our app here and do a fresh query. And we'll scroll on up here and have a look at the document references that from our fresh pull here. And scrolling down to the latest, down towards the bottom, the Michigan Advance Directive is now marked as entered in error via the doc status, and that is version 2 of that.
And we're going to have a little discussion. Lisa, would you like to do a little narration on what in the world is an entered in error? She revoked it. Would you like to help us decode a little of the opportunities that we have?
Sure. One of the challenges that we've run into, because we're implementing on FHIR R4, is that the status of the documents is bound to a value set that doesn't include a concept that really represents the real world scenario that Maria has been describing. This is not a document that in fact was entered in error. It was entered purposely, and it served its time while it was in effect. And when Betsy decided that she no longer needed that document to express her wishes in, she revoked it. And it's at that point in time that we need to be able to show that Betsy made this choice and that status now is canceled. There is vocabulary to support this use case in future versions of FHIR, but they are not available in FHIR R4. And so one of the big technical challenges that we're working on through the Connectathon and through our IG work is to resolve as a community what the best possible option is for utilizing extensions that either allow us to capture this canceled concept in another way, or perhaps look at a brand new construct called a cross-version extension that will allow us to adopt the part of the structure that's available in FHIR R5, but utilize it in FHIR R4. And we're going through a debate right now, a process of ironing out what's the best possible option. But unfortunately today we had to stick with what we had, which is our sole terminal state called entered in error, and that's why we're showing that.
That was so beautifully stated. And Justin, thank you for freezing there so we could, you know, upon first view, really dig into that. So Washington State, your consumer app looks great. Vanessa, would you like to bring up the reference implementation view of this revoked document? And then Juby will swing your team in.
Sure. Okay, so let's fetch the ADIs again. Okay, so we have the Michigan Advance Directive here. We can see the version 2. So the combination of the document reference status of current and the doc status of entered in error let us know that the Michigan Advance Directive was actually revoked. So we use these two elements to kind of show the users that the document indeed was revoked.
That looks beautiful.
And yes, I'll hand it back to you, Maria.
Thank you so much. I think it's really insightful and helpful in these Connectathons when you have, you know, two different EHRs that will show the same data. You've got two different consumer-facing apps that will show the same data. And I think it really expands the opportunities and the understanding to all the observers on how flexible and fantastic these standards are. Juby, would you like to go ahead and share your screen? We may want to go into the metadata a little bit, which you guys do so fabulously, to talk about that revoke.
So, you know, we go into the Advance Directive information, and you can see shows Advance Directive version 2 is entered in error, as noted in the metadata. See, I think this should be this is the voided version. Yeah, I mean, I guess this is definitely something to work out with once everyone is on FHIR. I guess we're sort of not sure if it's entered in error because it's revoked or because, you know, some other reason. But you know, at least this kind of gives some heads up for now. So I think that's definitely good.
We see this situation a lot when a lot of the seniors move from one place to other, especially in this region, from New York or New Jersey to Florida, and with families, and we see this as a common need. So this is actually an important part of this process that we have to make sure we address it. And I think we started this early version to get to an answer. So I'm just glad you guys, Maria and Lisa, kind of pushed us to kind of get here. Thank you.
Thanks, you guys. That looks fabulous. So in scene 5, which is our last scene, as Dr. Onko meets with Betsy over time, she says, you know, Betsy, I know you're doing all these documents. We revoked the Michigan one, and your sole goal is to have your voice honored should you need emergency care and treatment. So you've got a mental health directive. You've got a personal advanced care plan with so much information about who you are. I suggest we create a portable medical order. You are post appropriate, and I think that we should do this. EMS will honor it, emergency departments, it will follow you wherever you go. Let's do a portable medical order. Now, the doctor, instead of creating a structured document, which we will be demonstrating in looming Connectathons, again, she picks up a fillable form, a piece of paper, and fills it out with Betsy by hand. This portable medical order, that's document type 93037-0, supports those mental health advance directive provisions. and it really has some teeth that sometimes person-authored documents don't have in a world that is risk-averse and looking for legal. So she uses her clinician-facing app to upload this document. It's pushed to a national registry and repository. And of course, Charles and all of those other impacted parties can have access to it as well. I wanted to bring up a practitioner-facing app. And this is My Directives for Clinicians app. This is Dr. Onco, her oncologist. And so she's seen Betsy recently. So Betsy's already there in her recent list. When she clicks on Betsy's name, she can see the personal advanced care plan. That's how she was able to view it in its entirety and really formulate what she wanted to talk to Betsy about during that encounter. Here is the mental health directive. Again, she was able to see. There are Betsy's designated healthcare agents. And then we can take a look at the portable medical order, the PULSE, that Dr. Onco uploaded with Betsy. And it is clearly viewable and renderable in the clinician-facing app. We're going to allow everybody to show that, yep, I picked up the portable medical order too, so you can see parity between what the consumer apps are showing, what the practitioner apps are showing, what the EHRs are showing, and I think that's a really important piece. Let's go ahead and start with the reference implementation, if you don't mind, Vanessa, and you can show the latest view.
All right, so we'll go ahead and show the e-post. So we have it already fetched out here. And we'll take a view at the PDF. And we can see here the portable medical order PDF forms. And I will hand it back to you, Maria.
That's just perfect. Thank you so much. Washington State, do you want to go ahead and show the portable medical order in the consumer-facing app?
Certainly. So we'll retrieve fresh data here and have a look at our document references. And the latest one is this portable medical order. And there we have it.
Okay, super. Thank you very much. Now, Juby, we're going to let your team take us on home today. Go ahead and bring up your EHR app and talk to us about the portable medical order and anything else you'd like to bring focus to before we wrap up for today.
We'll open this up, get the Advance Directive app, get the fresh data, and let's see, we have my Pulse form. So that's displayed here. And looks like we have the whole form.
Well, that just looks fabulous. Is there anything you'd like to say, Juby, before I go ahead and call this an extremely successful event?
Sure. I just want to just showcase one piece. I wanted to say this is actually from a real provider perspective, especially small practitioners who actually are trying to do everything, and there are a lot of challenges. Then when I'm a nurse and a case manager, and we have Dr. Grossen, who's medical doctor, who was head of Medicare for Blue Cross and Blue Shield before she joined us. So this is from very intuitive, actual real world problems that solves the provider burden and all these additional challenges as a patient, as a provider, then a caregiver. And then inside the world of reimbursement and the insurance, that's what we have seen. And I see that Advance Directive is a very key piece why it's really necessary, this piece that we are talking about, including the challenges that providers face inside the space of just providing care, but there's less time you can spend with the patients. You have patients who have to see multiple types of providers. And then that's what actually, PACIO solves, really is a great program, which I'm a fan of. And I just wanted to say that thank you guys for bringing this forward. And this really helps that ecosystem.
No, that's great. We appreciate all of the people that come to the table. So that is scene 5. Again, what we really wanted to do in taking you through all of this was to combine structured as well as unstructured documents, make sure that we had versioning, that we had updated, work on our use case of revocation of a person's right to say, I don't want anybody to look at this particular form anymore. Maybe I don't have anymore. Maybe I've done a replacement. Maybe I've done 3 replacements. People will do what they do. And as Juby said, someone might move from one state to another and they want to revoke that previous state's document and create a new document. So the revocation use case is extremely important. I want to thank everybody for participating today. I know this was a relatively short recording, but I will tell you there are weeks and weeks and weeks and hundreds of hours in this work. We are grateful to all of you, and we are thankful for your time.